And we're going to get right into the conversation that Akumemunsem. How shall we put it?
This one is
matters of the heart.
Matters of the heart, but matters of the heart's health.
Okay. You know, February is, focusing in terms of health on one of the issues it focuses on is health, the heart health. And it's important for us to focus on heart health because you think about it, the heart is basically responsible for beating from the time you're formed in your mother's womb till you're born, till you die. It constantly beating, non-stop. The day it stops, it's all over. So it must not stop until you are ready to stop. Can you imagine? That's how serious the heart is, all right? So I want us to introduce our doctor and a nutritionist to you, and then we'll get right into the conversation. It's all about your heart. Well,
yes, all about that. Yes, I want to do the honors.
Yeah.
You are so welcome, Dr. Kelvin Owusu, wellness consultant, Violet Medical Center, and then we have Sarah Salome, Kylie Okine, dietitian, Violet Medical Center. You're both welcome.
Thank you very much. Thank you very much.
Yeah. And we would like to say that the screen behind us is proudly sponsored by
Violet Medical Center.
All right, so let's get right into it. You know, Dr. Kelvin.
Yes.
I think I want to premise this conversation by saying that of late, we have been hearing younger and younger people, coming up with heart challenges. And I'm putting heart challenges because there's such a plethora of different things that can be going on there. What's really going on?
Well, I mean, challenges of the heart are not new per se, but now because of the social media age or the proliferation of media, we are hearing about these things a lot more, right? So, I mean, that aspect is there. But then, depending on which aspect of the heart's health we are discussing, then we can see where the issues are coming from. A lot of young people, as you're saying, are dying from hypertension-related diseases. In fact, research has shown that up to 80% of all premature deaths are related to the cardiovascular system, cardiovascular diseases.
Please repeat that.
Up to 80%.
80%?
Yes, of premature deaths are related to the heart and heart health, cardiovascular system. And at the top of the list is hypertension. So a lot of people are dying now from hypertension because we are not paying enough attention to the heart and its related activities. But of course, at any age, there are some peculiar heart challenges that even children could have. So from the time of birth, to late, adulthood to the aged, there are heart conditions that they are suffered at various points. Not all of them. We can't do a lot. We can't do much about some of them, but there are others that we can do a lot about, particularly hypertension. I mean, we can do a lot about hypertension, but we are not doing enough. If we took all the hypertensives in Ghana, more than half are not aware that they are hypertensive. So this gentleman or this lady is walking around, going about his activity or her activity, and then he drops dead. And you know what the age was saying? Nothing he was fine. But the reality is that he was not fine because hypertension does not have symptoms. I engage people and then they'll say, when my headache comes, then I know my BP has come, But headache is not synonymous with hypertension. Hypertension does not have symptoms. If you start experiencing symptoms, then it means that there is some complication as a result of the hypertension. So you are suffering the effect of the complication, not the hypertension per se. The only way you can tell that you're hypertensive is to go and check your blood pressure. So if you're not checking your blood pressure, you are literally a ticking time bomb. And so it just takes one bit of occurrence, and then you are gone. So we really need to pay attention to it. And I mean, I'm happy that we're having this discussion because too many people are dying nowadays from these conditions that we have just spoken about.
Are there risk factors associated to heart diseases?
Yes. So in general, I mean, if we are talking about in the generality, yes, there are risk factors. There are some people that have special predispositions to heart disease and their offsprings for that matter. So for instance, in medicine, we say history always repeats itself. So if a parent had a heart problem as a baby, you know, or even as whilst he or she was developing in the mother, the probability that his or her offspring would have a similar heart condition is there.
Right.
You know, so if it runs in the family, you need to be looking out for it. So that's one of the risk factors, you know. But, and then also depending on the exposure, so some medication that the parent or the mother especially may have taken during pregnancy could have an effect. If the mother was drinking alcohol or smoking, could have an effect.
Okay.
You know, so all these are things that it's not your fault. Like, you were not the one that made those decisions, you know, so you can't do much about it. It's happened already, you know. But then moving on, then comes the lifestyle choices that we make, you know. So what kind of food are you eating? Are you, and that's why, I mean, Kylie is here. She's going to talk about that. What kind of food are you eating? Are you exercising? You know, and it's funny, Ghanaians, you know, you talk, again, like I said, I talk to people a lot. And they will tell you that my work involves a lot of walking, so I'm okay. So I'm okay.
Yeah.
But the body does not operate on that level.
Okay.
You see, and all that I'm saying is actually been research proven. There's been research done amongst groups of manual workers, people who actually work physical activity. Masonry, carpentry, and then they compared that group with other groups who are also manual workers, but also take time out to exercise. And then they compared that group to another group who are not manual workers, but they take time to exercise. And then, of course, there's a control group who don't do any exercise. And they found that the people who are manual workers, who also take time to exercise, have better indices, health indices, than those who are just manual workers and they just go about their manual activities and then without exercising. So even as a manual worker, you need to invest some time in exercise. You need to be deliberate about exercising, you know, and we don't do that enough. Maybe because of the traffic situation. I mean, coming here today, it was a battle, you know. So the traffic situation really puts us as Ghanaians at a disadvantage, or should I say greater Accra people, because I don't know what's happening elsewhere. You know, we need to be deliberate as a country to create the environment for people to actually exercise. We don't have that as of now. And when I used to be in the emergency room, you know, people would go out for a jog or a bike ride, and they end up with a fracture because somebody hit them from behind, or the road was not lit and they slipped and they fell. So we need to be deliberate about creating an atmosphere to actually exercise. You know, you travel elsewhere and they have parks, and in those parks are gym equipment that you can actually use. You see, in Ghana, where do you find those kinds of things? First of all, the park is not even available. You know, so where do you even go to you know, stretch out? So very important. So what are you eating? Are you exercising? And if you and are you even getting checked? You know, because of the economy, I was just telling my colleague that people are postponing their illnesses. You know, they are not even coming for the checkups.
Know what you are suffering from.
But the reality is that the life expectancy in Ghana, in spite of the advances we are making in providing health facilities and, you know, interventions, Ghanaians still die quite young. You know, we die quite young. Not many Ghanaians actually make it to 70, and that's not good enough. So we need to be deliberate about all these things. And the final thing is, so if you have been diagnosed as having one condition or another, are you taking your medication? And this is where we as medics always have a problem with the herbal people. You see, because they preach, they are always countering what we are trying to do. You know, as if to say that the herbal medications do better than the so-called orthodox medication. But in reality, they can work together. The challenge is that a lot of our herbal preparations have not gone through proper testing. And so we don't actually know their efficacy, you see. And look outside there on the streets. A lot of these herbal people are allowed to advertise, whereas the medical people are kind of restricted.
Limited,
So the first point of call for the average sick person is actually not the medical side of things. So they end up spending, wasting in quotes, a lot of time in places that don't actually get the results. And then by the time they come to the place where they can actually get the good results, they either don't have money or it's too advanced. So all these things need to be put in proper perspective so that we can deal with the problems holistically and then get, good outcome for the people of Ghana, because at this point we are not doing too well.
No, I find it very bizarre that we would allow a situation like this to persist, where the medical practitioners are by law not allowed, or by their own code of ethics are not allowed to advertise, right? But then the herbalists
who are in the same space of human health advertising rampantly and freely on every platform that is available. Now, Kylie, I'll come to you shortly. Just wanted to situate this for us. Heart disease, what is it? Well, I mean, the name is quite self-explanatory, heart disease. So any disease condition that affects the heart.
So it's not just hypertension.
It's not just hypertension.
Okay.
So hypertension is the biggest cause, is the biggest source of morbidity and mortality. Morbidity means illness or disability, and then mortality means death. So hypertension is the biggest. If you look at the blocks, hypertension is the biggest. And out of hypertension, you can get other heart diseases, you see. So because hypertension results in damage to blood vessels. Now, the heart itself has blood vessels that feed it, with nutrition. So the blood that goes into the heart, the blood that the heart is pumping, that's not what feeds the blood. After the heart pumps the blood, some of the blood now goes through blood vessels that now supply the heart muscles. Those are the coronary arteries. Hypertension can cause problems for those coronary arteries. And so you end up with coronary artery disease. And that coronary artery disease, the commonest presentation, the commonest outcome that many of us have heard about is heart attack. So when the coronary artery is blocked and the blood cannot go any further, then the muscles beyond that blockage die, and that is the heart attack. Or if the blockage is not complete and some blood can go, then you have what you call angina. So all these are heart diseases. Of course, you also have the structural heart diseases where like you have a valve problem. Now, valve problems could be as a result of infection. So the infection could result in the valve not functioning. The valves prevent backflow of blood. It makes sure the blood is moving in one direction. So when the valve has a problem, then the blood begins to go all directions, and that's not good. So it can result in something like heart failure. Then you can also have the congenital heart diseases. I'm sure you've heard about hole in heart, among other things. So those are congenital heart diseases. And those also come with their own challenges. Those you'd see much earlier. Some of them are even diagnosed before the child is born. Some of them, when the child is born, then you notice it, some of them can be corrected with surgery, but a few of them cannot be corrected, and they may have to go through life with that defect still present. And so, I mean, there are various challenges with the heart, but hypertension is indeed the one that's causing the most problems today.
Okay, let me come to you. What are some of the foods that one can take to make the heart very healthy?
Okay, so as Doc was saying that we have like other heart conditions. So we are going to base on the hypertensive diet. Okay. So we have something called the DASH diet. That is the dietary approach to stop hypertension. Okay, and there's a number of foods that you have to have in your diet. So you have like your grains. So your grains like this, talking about your wheat, your oats, and other things there. And you have like about 6 to 8 servings of that in a day.
6 to 8.
Yes, servings of that in a day.
Wow.
Yes.
We are lucky.
And I'm sure people even take more.
Wow.
Yeah, this is like this for hypertensive. So yeah. And then for your protein, your lean protein, you should have like 6 or less protein for the day.
Wow.
You have your legumes, your seeds, your nuts. That should be about 4 to 5 servings roughly in a week. So your beans, wache, and all that fall under the legume sector. Okay. In your low-fat diary, so if you are going for milk, if you're hypertensive, you could choose like a low-fat milk instead of the whole milk, or skimmed milk, or even almond milk. Yeah, that works well for hypertensives. And you should choose healthier fats. Okay. So unsaturated fats, monounsaturated fats. We are looking at maybe avocado, olive oil, all those things in moderation. Now, the most important thing here is your sodium intake. Right? So, ideally, we should be taking about 2,300 milligrams of sodium a day. That is 1 teaspoon of salt. Yes.
Some buy fufu and still pour some more sodium in there.
Yes.
Okay.
That is what we're supposed to take in the day. Now, in our sector, our country, you have like everybody doing extra salt because they want people to come and buy their food and all that. Yes, but it's actually not healthy at all. So if you want to limit your salt intake, you have to avoid like those canned foods because they are high in sodium. And just eat at the right place because because like I always say that sometimes our vendors are the ones that kill us. I always say that because I had a patient where he had a kidney failure, like end-stage kidney disease, right? And it was because of hypertension. Even my cousin recently would have died. May so rest in peace. It was through hypertension that his the kidney failure even came up.
Wow.
And they don't know that it's the food they are eating outside.
That's doing
the energy drinks, too much energy drinks. I'm tired. I'm just taking all
That's
that.
my shade. That's my shade right
Yeah,
there.
like
I'm not gonna
you
comment
can
on
always have the healthier option.
Right.
And you need to exercise, as Doc was saying. You really need to, at least 150 minutes in the day, DA, you have covered. At least 150. And your fruits and vegetables, I can never forget that. I won't forget the fruits and vegetables. These are high in, like, they have minerals in there. Potassium, studies have shown that potassium, calcium, they also help in lowering your blood pressure.
Right.
So you have to have like these minerals in there to help you also. So, you know, I was telling somebody that we've made our normal food look like dieting.
Okay.
Junk is now normal food.
Normal food, yeah.
Kontomire, garden eggs,
It's like specialized
It's
food.
like
dieting.
Yeah.
But no, that's not it.
That should be normal.
That should be normal.
Yeah.
That should be your normal diet. That's your medicine actually.
Right, true.
Yeah. So these meals are supposed to be in place. Your oil intake should be also low. Yeah, mind you, if you are obese, you are predisposed to having hypertension.
Hypertension, true.
And you have it genetically in your family. You should be careful. Like, eat as you're supposed to eat. Don't take, if you know, people, hypertensive say, yes, I'm in this salt. No. We are not saying that.
Moderation.
Your body needs the salt. The limit you should take in the day is like 1,500 milligrams in the day. That's like half a teaspoon. Yes.
Are there foods that are this, you should know that this food is totally good for your heart? Are there foods like that for us?
Like I've mentioned, all the grains are actually good.
All the grains.
Your fish.
You don't even need to be hypertensive.
Oh no.
Right.
Your fish, your lean meat is good because you are not having too much fat in there to block the vessels in your, or even to increase your cholesterol levels. So yeah, all those foods are very necessary. You also need to know how to rest.
Know how to rest.
Yeah, you have to know how to. People still, but sleep is not rest.
You're right.
Sleep is not rest.
Yeah. Sleep isn't rest.
Sleep isn't rest.
Yeah.
Like just have the right meals.
People go to sleep and they wake up exhausted.
Yeah.
It means you were not resting.
Yeah.
Yeah.
Your
And
mind
you
is doing lots of
and you
thinking.
can rest, and yet you haven't slept, but you're rested. So yeah, that makes a lot of sense.
Yeah. So
I wanted to ask you, Dr. Kelvin. So, belly fat. I'm saying belly fat because in the concept of exercising, right, we talk about how that, I actually was watching a training video, and the lady was saying that every inch of fat around your belly, you're shaving off time of your own life.
That's graphic.
I know, right?
Yeah. So, but I'm also asking this question and connecting to the heart conversation that we're having here. Fat gets stuck on organs.
Yeah.
Not just what we see on the outside, but so we talk about fatty liver and all these other kinds of conditions and so on. Talk to us about what fat does in the body and how dangerous it is.
Well, I mean, so first of all, let's understand that fat has a role to play.
Yes.
You know, you need fat. You know,
absolutely.
Yes, you need fat.
I mean, otherwise testosterone will not be possible.
And even the conduction
You know how it
of
is?
You had to.
Yeah, no, I know, yeah, I mean.
yes. And also for conduction of, brain activities, you know, so fat is necessary and different. I mean, there are different, I'm using fat in the general sense of the word. There are different types of fat, but all of them are necessary in their right quantities. It is when they go out of sync, that's when we have problems, you know. And abdominal fat is actually one of the kinds of fat that we worry about a lot, you see. Yes, because there's a lot of, there's a lot of room in the abdomen. There are organs there, but there's also a lot of room, right? Now, when it comes to fat, what you see on the outside is actually a reflection of what's going on the inside. You see, it's like they say,
okay.
You know, so when it starts to show outside, it means that like it is
it's
full.
loaded inside.
And when the fat is loaded inside, you are now putting pressure on the organs. You know, and I mean, if there's a lot of fat in there putting pressure on the various organs, let's use the what's it called, the vena cava and the aorta. They are also in the abdomen, carrying blood to the legs and carrying blood from the legs up there. It means that the body is not able to, the pressure that the heart needs to generate to force the blood through these blood vessels is higher than what it would have done if there was not that much fat.
Okay.
You see. So then that's, and remember the heart is a muscle. And what happens when you put muscle under pressure? When we go to the gym, all we do is put muscle under pressure. You understand? When you put muscle under pressure, it's going to expand, you know. When this expansion is happening in your skeletal muscles, which are the muscles that you are seeing on your body, it's nice. When you take picture on Instagram, you get plenty likes.
Yeah.
So we like that kind of expansion.
Yeah.
But the heart does not like that.
Okay.
Because the heart is pretty much fixed from the time you are born. You know. Whereas the muscles here are new fibers are added on to create the bulk. The heart does not have that ability. So it's the same muscle that now begins to stretch. You know, so now because the heart begins to stretch, it becomes incompetent because the heart is a pump. So it's no longer able to pump the blood because the valves begin to pull apart. So that's a disease that is actually called hypertensive heart disease.
Okay.
So now the valves which are supposed to maintain the one flow does not happen, you see. And it's all because of the pressure in there. Now, when because of that, research has actually stated clearly, if you were to lose 10 kilos of fat, your blood pressure would also drop by approximately 10 points.
Whoa.
So for every 10 kg you lose, your BP will respond in you know.
Wow.
And for a lot of people, just by losing weight, they may not even need to be on medication for hypertension and even diabetes to a large extent.
Wow.
Because when your fat begins to build up, you know, it also causes insulin resistance.
Yeah.
So fat and insulin are opposites. They don't like each other. So the more fat you have, the less effective insulin is.
Becomes,
you know, and then your sugar levels begin to go up.
Wow.
So this is actually why hypertension and diabetes tend to move together. You know, if you get diabetes first, you end up developing hypertension later. If you get hypertension first, you end up developing diabetes later. And people who are overweight and obese have that predisposition. So, you know, once you start seeing belly fat, and a lot of guys or gentlemen will tell you that it looks good when I wear my shirt, you know. Well, I mean, you do look good, but then how good do you be looking in the coffin? You know, so we need to, you know, keep some of these things in check. But ultimately, it comes down to our eating habits, you see. And the biggest culprit, especially amongst corporate workers like yourselves and myself included, is late eating. Now, in the past, we used to give a specific time that you're not supposed to eat beyond. So you talk, people say, I don't eat after 6, I don't eat after 7. See, right now, it's a matter of when do you eat and when do you sleep.
Okay.
So you might eat at 6, all right, but then you are sleeping at 8. That is late eating.
Okay.
Because once you eat and you go to bed, all that food is going to be converted to fat because the energy that the food is going to give you, you're not going to use it. And the body, you see, from the time we were born, evolution has made us efficient in storing energy for tomorrow.
Okay.
So the body does not waste energy.
Okay.
Any energy that you don't use is going to be stored as fat. So fat is the energy you were supposed to use yesterday that you didn't use. So it's waiting to be used. But now, because tomorrow you are going to eat again, the energy that was stored for tomorrow, you eat again, and then the body will prefer fresh food to old food.
Yeah.
So they will break down what you ate today and ignore what was stored yesterday.
It's like some men.
So that's why you keep putting on weight.
No, it's like some men. They like fresh food instead of old food all the time.
To add to that, it's when you eat, what you eat, and when you sleep.
Say it again.
When you eat,
When you eat,
what you eat,
and
when
when you sleep. These are the key things we need to pay attention to.
Yes, somebody will eat, like you work very late. Somebody that works very late into the night. There are some things you need energy. Some things will tell you to eat. Okay, so you can go through the night with the meal you are taking. Some parts he was saying, I eat at 7. I'm sleeping at 7:30.
Yeah.
What do you
Some
expect?
people are sleeping while they are eating.
What do you expect?
Yeah, they're dozing off as they are.
What do you expect? And like they're not even taking like the right meals, right? So they're taking more fatty foods
Right.
at the latter time of the day.
Can you get to 90 without hypertension?
Oh yes, I mean that's
You can.
that's a very easy question to answer.
Really?
There are several there are several 90-year-olds who
Yeah.
don't have hypertension.
How do we do that?
First of all, it starts with genetics.
Okay.
Now, where we find ourselves, unfortunately, we are at a disadvantage because hypertension is indeed a black. And here's and mark my words: hypertension is a black man's disease.
Okay.
So black men have a higher risk of hypertension
Yeah.
than black women.
True.
Then number 2, black men are more likely to die from hypertension than their female counterparts. Yes. So the genetics plays a key role. So and so now, come to family. If it's already in your family, then your risk of developing it is even higher.
Yeah.
You know. Then your line of work. I already mentioned that if you're a corporate
Yes.
worker, your risk of hypertension is already there.
Yeah.
There's a category of workers who, by default, they are hypertensive until proven otherwise. And I mean, and those are the bankers.
Yeah.
Like they are hypertensive until. If I see a banker, you are
Too many
hypertensive
sedentary
until
hours.
we check your BP.
Yeah.
You know, so you are guilty until proven innocent. That's for them. You know, so all those things matter. Then your lifestyle choices.
Okay.
Are you regularly exercising? Are you eating the
Eating
right
right.
foods at the right time and sleeping at the right time? And you see, this is where just yesterday, so I have this routine I do on Mondays where I remind people to have their BP checked.
Yeah.
And then yesterday I did it as usual. And then somebody said, I think the first comment was like, even healthy people die.
Hey.
Yeah.
Really?
And I was like,
Yeah.
I was like, well, that is true. You are
Yeah.
right. But how many healthy people die versus people who are hypertensive who are dying?
Yeah.
And then secondly, how do you know who a healthy person actually is?
Yeah.
The fact that the person is walking around does not mean he or
Yes,
she
healthy.
is healthy,
Yeah.
you see. Because I already told you that hypertension has no symptoms. Yesterday, a gentleman walked into my clinic whose BP was 190 over 110. And he didn't come to the hospital for hypertension.
Oh.
He came to the hospital for something totally unrelated.
So if it wasn't for the regular vital checks that you do,
Exactly.
you would never have known.
And he was now, he was worried that we were concerned.
He wasn't bothered.
Because after the nurse checked the blood pressure, she kind of immediately, literally pushed and put him in a bed, and then we had to go and attend to him. And it's like, why are you pushed? I just came here because I had to come and take a vaccine or something, and then now I'm in bed. Why are you stressing me? I have to be here, there. You see, so it's a concept. This whole wellness thing is a concept that we need to embrace as Ghanaians. You see, because when you are sick, you are not only paying out money from your pocket, you're also losing your ability to make an income. So we have to pay attention to our health now that we seem to have it, than wait until, you know, we lose that health and then we are now running around trying to live healthy and among other things. It starts today. You know, so we need to all pay attention to this thing. So belly fat has to go. That one, there's no question about it.
It has to.
But the last point I want to make is that when you want to lose weight, you cannot target the weight loss.
Okay.
So today, let's bust that myth right now.
Please do.
You cannot target the weight
Weight
loss.
loss and say,
There's nothing.
I want to lose weight on my buttocks.
Exactly.
Yeah, it doesn't work like that.
It doesn't work
Today you're
like
really shading me.
Oh, it's not about you.
You're shading me.
Oh,
Yabepong.
is it affecting you? Oh, it was affecting you. Please, I'm sorry. I was not trying to shade you. But you're trying to lose weight on your buttocks. Yeah.
You cannot target weight loss. You see, the body determines where I will lose the weight from.
Yeah.
Okay.
There's nothing to target the weight loss.
Okay.
Yes, you can target the muscle buildup.
Okay.
So you can do stomach exercises to strengthen the stomach muscles.
Okay.
But there will always be a layer of fat above it, which will go when it's time to go.
When it's time.
Yeah.
Okay.
Do you get what I'm
Okay.
saying? So you might have strong abdominal muscles, but there's still fat sitting in front of it.
Yeah.
Yeah.
And the exercises that actually will deal with fat are the aerobic exercising, jogging, swimming, tennis,
Yeah.
dancing. Those are the exercises. So if you're not doing those exercises, you're not going to get much results from the weight loss you are going
Yeah.
through.
Yeah.
You know.
Doc, you realize some of us would like to stay healthy, like you're saying, till 90 and beyond or above. So we go at exercising rather very hard, and
Yes.
sometimes it even affects our heart.
True.
Yeah.
True.
and then we stay away from medication totally, like you're saying. How can you combine the two?
I think she mentioned a key word, moderation. Moderation, because too much of everything is bad, you know. Because and you do need some fat to keep you alive. Some people now, I've seen videos where the guy's body fat content is like
10%.
yeah. Why?
Going lower than that.
Why? You see, so I mean, moderation is the key. You cannot go hard at exercise and ignore a good diet. You cannot go hard at exercise and ignore rest. You see, you cannot go hard at exercise and also be in a stressful job. You know, because all these things are kind of counterproductive, or they cancel out each other. So you need a little bit of exercise, a little bit of good food, a little bit of rest, you know, a good career to put everything together. Because ultimately, if you don't have money, you know, poverty is even a bigger killer than hypertension. You know, so let's face that fact. It's very, very important that we put all these things together, you know, so that we can then enjoy the life that we have been given. You see, and then we can live to the 90s. If a lot of us were doing all these things in moderation, you know, we will probably reach that 90. But ultimately, genetics counts. How old were your parents before they died? That should be a marker. So then you need to find what killed them. And that's another key point. Many of us don't actually know what killed our parents. Yes, it's true. Many of us don't know what killed our parents. And so now, how do you prevent a similar outcome? If you speak to somebody, a lot of people from the West, I mean, not everybody, but a lot from the West, they know what killed their parents at a particular age. And so they put themselves in readiness. Okay, so if I die at this age, you know, this and this should be done. Or what killed them, is it preventable? Let me do this to avoid that. You know, so we need to know our family history so that we know how to avoid certain things.
I think in Ghana, most people they think it's a waste of money to go and find out the cause of
Yes, it's true.
I think it's a waste of money.
But it's a very, very important part.
But the Birth and Death Registry has started something last year where I was a part of. And they called all the stakeholders involved. You know, our Muslim brothers, most of them do not do that at all. So the chief imam had a representation there where that was discussed in 2022 on to 2023. So autopsy is going to be somewhat of a need.
Yes, it has to.
So they have the statistics and the data to know what's any cause of disease that is going high, that is on the rise, those that are on the low and the low. So I think in Ghana, something is being done about it.
It's long overdue, to be honest. Long overdue. And they should advise policy, because ultimately all this discussion, if the policy side does not match with it, it's a
waste of time.
You see, if we are constructing roads and we are not putting pavement, I mean, my area, they are constructing the road, and there's no pavement. So where am I supposed to exercise?
No, I think it's critical.
It is.
It's actually a critical conversation that we need to have as a nation. Where are the pavements? And then when we leave hawkers to sell on pavements, we leave market traders to sell on pavements, and we allow grass to grow on paving stones. It's illogical.
Let me chip in this. Are you aware that there's research in Ghana that supports the fact that noise increases your blood pressure? So now the question is, on the policy side, what are we doing about noise? You are sleeping in the night in your own area, and then somebody with a megaphone is making an announcement, disturbing everybody. Or the church next door is doing all night. Or the mosque is blaring their call prayer.
The sport is open and speakers.
So there's a disconnect between policy and what's happening on the ground. You see, we are not applying all these things. So we are not a healthy people. Period. And all these little things are feeding into why we are dying at a much younger age.
Dr. Kelvin Owusu, wellness consultant at the Violet Medical Center, and Sarah Salome Kylie, dietitian, also at the Violet Medical Center. Thank you so much, gentlemen and lady, for coming.